Hello, everyone. Welcome to UF Health Wellness University webinar. I'm Marcia Mott, the coordinator for the UF Health Wellness University program. I'm so glad you've joined us today. We're going to discuss the COVID-19 vaccine today, and I'd like to introduce you to our speaker, Dr. Michael Lauzardo. Dr. Lauzardo graduated from medical school at the University of Florida in 1991 and later received a master's degree in epidemiology from the University of London in 2008. He's board certified in internal medicine and pulmonary medicine. Dr. Lauzardo is also the deputy director of the UF Health Emerging Pathogens Institute and a public health specialist who directs the UF Health Screen, Test, and Protect initiative. Dr. Lauzardo has always wanted to be a part of the positive change in the world, and that trait led to his work in public health and infectious diseases. He does research in pulmonary medicine, tuberculosis, and mycobacterial infections. In his spare time, which there's no doubt less of lately, he enjoys spending time with his family and reading. If you have questions for Dr. Lauzardo, you can submit written questions at any time using the Q&A button at the bottom of the screen. At the end of the presentation, I'll read your question anonymously. We'll only be accepting written questions today, and I'm going to try to get through as many as we can. Dr. Lauzardo, I'm going to turn it over to you now. Thank you.
Great. Well, good afternoon, everyone. Thank you so much for joining us, and thanks for being here with us. I'm going to go ahead and share my screen here in a second, and hopefully I can get that done pretty easily. All right. Well, good. All right. So let me go ahead and get us started here. I can move that out of the way. There we go. All right, great. So I'm going to go ahead and talk to you today about COVID-19 vaccines and more. And what I want to do is go ahead and start out by talking about kind of the bigger picture and then kind of bring it into vaccines, because really at the end of the day, that's what we're here for today. And that's what's on most people's minds. So I'm going to just talk for a little bit, about 15 minutes or so, and then leave plenty of time for your questions, because really you've got great questions, really good information there. And that's really what we want to make sure that we address and take care of for you. Well, let's just talk a little bit about kind of how we got here, right? So this has been going on now for over a year, and many of us kind of lose track of kind of how this all started. As best we can tell, the coronavirus or COVID-19 started in Wuhan, China. And this was from a variety of different sources, appears to have started and was centered around a seafood market, which is an open market where a lot of different forms of not just seafood, but other animals that we're not used to eating in our culture necessarily, but where in these markets there can be transmission of viruses from other animals to humans. And the thought is that the reservoir host, and that's a medical term for an animal that can carry this virus that normally doesn't transmit to humans, but for whatever reason, it was able to make the jump from one animal species to another, namely us. It wasn't clear, if you can see from this cartoon down in the bottom, that if it went from bats to an intermediate host, that's kind of a drawing of an animal called a pangolin found in Southeast Asia. And that animal could have then transmitted to humans. And usually that's from eating them. And that's where the transmission could have occurred. Now, coronaviruses affect humans, and in fact, many children get them. We've all gotten coronaviruses. There are 4 human coronaviruses that cause kind of mild symptoms and a mild cold. But obviously, with this cross from a bat version, we believe, of the coronavirus to a human version, this led to our immune system not really being able to handle the sort of kind of mix up between those 2 different viruses, and it made things very difficult. From there, the rest is history. It was not able to be contained in China and then spread rapidly around the world. And in this age of globalization and air travel, spread of a pandemic is very, very easy and can happen easily within 24 hours and sometimes even less. And so shortly after the emergence of this in the fall of 2019, hence the name COVID-19, it then spread throughout the rest of the world, and the rest is history. And what's happened is something that hasn't happened in any of our lifetimes, right? So in other words, this pandemic that really has caused the world to completely stop. There have been other pandemics in the course of our lifetime or lifetimes, depending on who's on the call. Usually those are related to influenza. So you've had them in 1968, I think 1956. You had the 2009 H1N1 pandemic. But most of these have been related to influenza, where it then spread, a new type spread, and went around the world. But as you can see from this map, this COVID-19 dashboard from Johns Hopkins University, the entire globe has been affected. And when you look at the global number of cases, you look at that number 110 million in the top left corner of the screen, that's really an underestimate of the true impact and the total number of people that have been affected, largely because lack of access to testing and kind of difficulty with making the diagnosis in poorer parts of the world and incomplete reporting. The bottom line is that probably is close to 1 billion people worldwide have had this. And probably when you look at the United States, the numbers there are probably more than the 28 million that's listed there. It's probably closer to 100 million or more when you look at the number of people that didn't have access to testing earlier, for those that have symptoms that don't get picked up. And so that extent is probably pretty significant. So maybe as many as 1/3 of Americans have already been infected. And we've already heard a lot about the death toll, where we've passed a very grim milestone with over 500,000 Americans having died from this. I also want to clarify something that might be a misconception out there as well in terms of the severity of COVID-19. It can be very mild and an asymptomatic illness in some people, whereas in other people, it's life-threatening and has caused lives to be shortened. But when we look at that, I've heard some people say that, well, this isn't really, these are people that are dying anyway. You're just testing them before they die. This is just a way to add to the numbers to make it look worse than it is. Having been in the ICU with these patients, having been in the hospital, seeing the COVID wards, diagnosing these people, these are people that are dying because of COVID, not just with COVID. And so I won't go into the details here, because it goes beyond the scope of what we're going to cover today, but the impact of this has been dramatic. And I cannot emphasize that enough, that this is something that we need to stop. And that's why vaccines are so important, because this is not just another something. This is an important thing that we need to continue to address. And vaccines is going to be a key way to do that. In Florida, unfortunately, we've not been spared, as no other part of the world has been spared either. Again, this was just from a few days ago, so it's a little bit outdated. The numbers have increased a little bit. Where we're getting close to 2 million total cases in the state of Florida. And realistically, even with the testing that does go on in the state of Florida, we're probably still short on the total number of Florida's nearly, or about 20 million residents. Probably, if I had to guess, I would say almost 1/3. So maybe 7 million, and maybe even a little bit more than 1/3 of Floridians have had this already. The impact is huge. But it's also important to remember that after the very difficult time in terms of early January, late December, after Thanksgiving, all that period of time where the case numbers went up, largely because of increased travel, getting together during the holidays, sharing meals indoors, all these things led to an increase in a surge in cases, the largest surge that we've experienced. But the great news has been that over the last 7 weeks, the cases have been dropping, and they've been dropping pretty steadily. It's not just something that we're seeing locally, and I'm going to talk about some local numbers here on this current slide, but we're seeing that nationally as well as internationally, rates are dropping. And this is really, really good news. There's a lot of reasons for that, but it really hasn't been from the vaccine yet. Really, the benefit from the vaccine is going to come in a few weeks when we get more and more people vaccinated. You're going to see the big impacts on that, and the numbers will go down even faster. At least we're optimistically hoping for that, and I think there's a good scientific reason to believe that. What we're seeing here through UF Health is that fewer people need to be hospitalized. That's something that's being seen pretty much all over the country, with a few exceptions. The numbers in our home county here of Alachua County, for those of you who are not here in Alachua County, your counties are probably dropping as well. And we saw our lowest weekly total last week since June. And that's pretty much true throughout the state of Florida. And for those of you outside of the state, that's probably true in your area as well. We're seeing really nice, consistent drops in the numbers of cases. Testing positivity has dropped down to about 3.2% during the worst of the pandemic. We saw rates that were as high as 18, 19%. And the statewide average now in Florida is just around 6% and slowly decreasing there as well. So all the news right now is very, very good. And I think we're heading in a good direction. Some of the things that we've been planning to do and that we've been putting into place, the things you've been doing, taking care of yourself, wearing masks, being careful with what you do, that's really starting to pay off. So we want you to keep that up. Quick word about prevention. So we're going to talk about vaccines, but I'm also going to talk to you about the importance of continuing to do the things that we've been doing all throughout the pandemic to help slow down the spread. So that means keeping to wear masks until we can say that it's a good time to go ahead and take those off after you've been vaccinated. But right now, even after I've been vaccinated, I still have my masks readily, handily. Actually can't see it too well on the screen there, but I still have my mask. We still wear our mask because there are some things we still don't know in terms of how we can maybe spread to others, even though we've been vaccinated. But again, we hope soon to get back to normal, and vaccines are going to be the path for us to get there. Remember, wear good masks. Don't put them as a sort of a chin cover or a what I call a nice cookie crumb catcher. It's supposed to cover your mouth and your nose. So just make sure that that does fit that way and that it fits snugly against your face. Don't use them with exhalation valves. So those tend to allow you to spread to others if you become infected. And let's continue to do that social or physical distancing when you're indoors, especially in areas that you have that community transmission, which is pretty much all of us right now. Outdoors without a mask is safe as long as you're not near others who you don't live with and are part of your quarantine group. And in fact, I would strongly encourage, as the weather continues to get better and better for us, certainly in Florida, it's definitely outdoor weather now. But for those around the country who might be listening, as you can get outside, outside is good. It's healthy and helpful and not a place where we see a lot of spread. All right, let's talk about the meat of what we're going to talk about today, and that's a vaccine update. And let's kind of walk through that. And again, I think a little bit of background here will help us with some of the questions that you've had, and also hopefully give you a little bit of context and background to kind of understand things. So Operation Warp Speed was the name of the partnership between several different federal government agencies, as well as the private sector, namely the pharmaceutical companies that make vaccines, to accelerate the control of COVID-19 by developing and manufacturing new technology. In other words, new things like vaccines and other treatments. There are definitely new treatments and definitely new forms of diagnosis that are coming out, but that's not what I want to focus on. I want to focus on the effort to really develop these vaccines. And the important thing here is that a lot of people tell me that, you know, I would get the vaccine, but I'm worried that they developed them too fast. And yes, they were built or actually developed and manufactured very quickly. But I'll tell you, from a scientist standpoint, from a physician standpoint, they didn't skimp on the science. Nothing changed with the science. What they did is they got rid of a lot of the government bureaucracy, a lot of the financing problems. The government basically let the pharmaceutical companies be held harmless. If it didn't work, they didn't lose any money. If the vaccine didn't succeed in what we call clinical trials, those are the experiments that we do to make sure that it works. If they didn't work, they wouldn't lose money. The government would have paid them. And so we had vaccines that worked and worked beautifully. And I'm going to talk about those here in a minute. And we also had a couple of companies that tried and it didn't work out so well. So they didn't produce their vaccine and they didn't lose money, but everything moved very quickly, but efficiently. And so again, I'll tell you that the science is solid, and I was so confident in it and so confident in that process that I couldn't wait to get the vaccine when I became eligible to get the vaccine. So this is an important thing for us to move forward. Now, with Operation Warp Speed, this is focused on just the American effort to develop vaccines. Literally, there are probably a couple hundred different vaccines that are being manufactured and developed around the world in all different stages of development. This was probably the single largest scientific effort ever to develop, certainly to develop a vaccine, but also you can argue to any concerted, directed effort to build anything, going to the moon, building the space shuttle, curing cancer. This has been the single biggest effort, and it's really paid off. Of the 8 vaccines that the Operation Warp Speed kind of developed, that there were 6 that actually moved forward with partnerships. And actually there have been contracts with the federal government to pay for these as they moved forward. Moderna and Pfizer have become household names. These are the mRNA vaccines that have been on the market since mid-December. And these are the vaccines that pretty much everybody in the US that's been vaccinated has been vaccinated with these. There are some people that might have been in clinical trials that have gotten the vaccines from AstraZeneca and Janssen or Johnson & Johnson. These are a little bit of a different kind of vaccine that uses a different kind of virus that we can't get sick with, that can spread the information to our body so that it allows us to be able to build an immune reaction to the virus. And then 2 others that you haven't heard about yet, that's Novavax and Sanofi GSK. Those are probably going to come out later, probably in the summer, and when those clinical trials are done. What's really exciting is that these platforms or these types of virus vaccines against the virus work really, really well. Moderna and Pfizer in particular have an effectiveness of 95%. We're seeing that in our practice, and we're seeing it in the field as we're vaccinating people, and people tolerate these really, really well. In studies where they did thousands and thousands of people included. So in other words, they would get 30,000 in one group and just give them a saline shot, kind of like what we call placebo. And then in the other group of 30,000 people got a vaccine that had the actual vaccine in it. And we compared how many people got COVID in one group or another. So in a group, say, of that 30,000 versus 30,000, the group that got the vaccine, or the group that didn't get the vaccine, got COVID, say, 100 cases of COVID. And in that same group of people, or in that same study, in a different group of people that did get the vaccine, only 5 people got it. So in other words, it was 95% effective. The chance of you getting COVID was 95% less. But what's really important to remember is that with every one of these vaccines, with Moderna, Pfizer, AstraZeneca, and Janssen or Johnson & Johnson vaccine, which is probably going to be the next one to be approved, nobody who got the vaccine died. And think about it, what we really care about is severe illness and death. If someone gets a cold or mild symptoms, it's not a big deal if they don't spread it to someone who could be really sick. But if we're vaccinated, the chance of you dying from COVID, based on what we know right now, goes to 0. That's amazing. And that's something that is not gotten enough press. And really, there hasn't been enough attention focused on that. Here, just kind of moving along, I want to show that the progress that we're making throughout the state of Florida in terms of vaccinating people. You can see the breakdown here in terms of the total numbers. I know it's a very busy slide, but I want you to focus here on the right side about the demographic summary, that looking at the age groups that people are getting. Where the focus has been on people 65 and older, because that's where the risk is highest. And those who've gotten the vaccine who are younger than age 65, those individuals are mostly healthcare workers. They're either healthcare providers, they're seeing patients, they could be students, but most of them are going to be in the healthcare field, directly affected by or directly in contact with patients. And it's not so much to protect them, but also to protect their patients if they get sick. So again, this works in multiple ways. And in that top right corner, you can see over 2.5 million Floridians have been vaccinated, and over half of those have completed the series, or about half of those have completed the series. All of these are 2-dose vaccines, and we'll be getting a 1-dose vaccine here shortly. So this is what I call a good news slide. There's still a long way to go, and a lot still left for us to do. But it's important to remember that in at least in Alachua County, where we live, and some other areas, we're over 65% of Alachua County residents over the age of 65 have been vaccinated. So hopefully soon we'll start opening it up, and I'll talk about the priority groups here in just a moment. On this next slide is kind of it shows the same thing, but just goes by the number of doses given by day throughout the state of Florida. Some of this varies depending on vaccine availability, and the latter part of this slide, looking at February 15th and 16th, in particular February 14th, weather problems affecting delivery from other states and where the vaccines are manufactured kind of results in that kind of slowing things down. I want to talk a little bit about kind of how things are, what some people are concerned about with not getting the vaccine. And there's some myths out there that I want to address, and not so much myths, but maybe misunderstandings and things that we as physicians haven't been really clear about as of yet. And the first thing is that some people think that vaccines are not going to be effective until weeks after the second dose. Now, if you're taking one Moderna or Pfizer and eventually AstraZeneca, and you need 2 doses, we want you to get those 2 doses. But there's a benefit just as soon as 2 weeks after that first dose. And so there's a big impact from that right away. I've also heard some people say that, hey, I'm not going to get that vaccine because this is a way that the government can track us. They can do some blood work and find out information about you. That couldn't be farther from the truth. And again, that's why I think you should look at not just UF Health, but there are other universities, other health systems, official groups, people that know what they're doing, experts, true experts, that can give you information. Be careful of Facebook University, and be careful of looking and listening to Dr. Google, okay? So Dr. Google and Facebook University are not good sources of information. You need to get those from reliable sources, the CDC, your state Department of Health, other universities, and check more than one source. Check the things that I say, check things at other sources from other reliable institutions that you would go to for healthcare. You wouldn't get medical advice from someone on Facebook, would you? You wouldn't ask, Dr. Google to kind of see which chemotherapy you should get for cancer, would you? You go to an expert. And the same is true about vaccines. Others might not want to get this because they hear the word mRNA and they think that it might affect their DNA. And then they may want to get pregnant if they're of childbearing age. This does not affect your DNA at all. It does not integrate into what's called genetic information. It doesn't affect that at all. and it doesn't have the virus in it, so it can't make you sick from the virus. That's important. The other thing, people have been talking about the virus variants. So these other isolates that are out there, these different strains of the virus that make the vaccines not work. We're watching that very closely, and that's an important issue for us to pay attention to. But right now, we've not seen enough evidence to say that these vaccines are not going to work. There's some evidence that some of them may not work as well, but again, nobody dies who gets the vaccine, nobody dies from COVID who gets the vaccine. And that's important. So they may fail a little bit more commonly. In other words, you may still get COVID, but a very mild illness. So it's very similar to the flu vaccine. And remember, the flu vaccine is something that we give every year, and it might be effective only 30%, 40% of the time, but yet it still saves lives because people don't get so sick that they die from it. Lastly, I want to just point out I want to get the blank vaccine. I want to get Moderna, or I want to get Pfizer, or eventually when Johnson & Johnson comes out, I want to get Johnson & Johnson, so I'll wait until that's available. Again, think about the last vaccine that you got. Did you ask what company it was that made the vaccine, or which brand or which version it was? These vaccines work, and we have to trust the FDA and the regulatory agencies and the scientists who study this, because the vaccine that you need to get is the one that you can get as soon as possible. What we strongly recommend is that you get the ones that are available, and we're going to use the ones that are available so that we can immunize the population, so we can get to the point where this virus stops spreading throughout the community. Now, again, just a quick word about what UF Health is doing, and probably in the areas where you live, other groups are probably doing similar things. But I just want to talk about what UF Health is doing in particular, because we're really looking at this from a very comprehensive approach. What we've done is we've established a really productive health department partnership. And we've been working hand in glove with them since the very beginning, when we started doing our contact tracing and other things to kind of move things forward. And that's been critical because it allows us to register people faster, vaccinate more people, get access to vaccine a lot easier. And we become, as they say, a force multiplier. We can vaccinate more people more efficiently. We've been working with our local school board. That's the Science Medical Advisory Committee group that we call the SMAC. We've been working with Vaccine Scale Up. We're trying to reach vaccine hesitant populations in Alachua County. That's the east side of town. We're also working with IFAS, the Institute of Food and Agricultural Sciences here at the university, to get to farm worker groups and to sort of get them understanding about vaccines. We're also getting a therapy called monoclonal antibody. It's a really long word for a kind of infusion. President Trump got that when he was early on in his illness, and it probably saved his life. So monoclonal antibody access for people that get diagnosed with COVID, and they get this infusion, in other words, this IV that can prevent them from getting really sick to the point of dying. And also we're doing a lot of community education like this outreach, and we're reaching out to a variety of different groups. We're working with Gainesville Pastors Association, Black on Black Crime Task Force here in Alachua County. Rotary is going door to door, registering people for vaccines in our community. And we've also established a Vaccine Access Steering Committee, because we really want to make sure that everybody has access and that nobody gets left behind. Now, a lot of times when we think about vaccines, for some people think vaccines are controversial, and really a lot of times it's just from doubting science. This young lady here in a protest in Madrid about, saying it says in Spanish, says no vaccines, no masks, and apparently she doesn't want to have 5G cell service either. I'm not really sure what that's about. But the bottom line is that people who are reluctant to do this are not just those who are adamantly against vaccines. I don't know that I'll be able to convince those people. And in fact, I don't want to convince anybody. I just want to give you all information that's factual, based on evidence, based on expert opinion and the data, the evidence that we've got, so that you can make the best decision for you and for your family. And for us to just empower you to be able to make a good choice. These are difficult times, and a lot of things have been taken away from us, but those options and that autonomy to make the right choice is something we want to give you back by informing you so you can make informed decisions. And speaking of which, another thing that will build confidence in the vaccine process is being able to vaccinate at scale. So in other words, we've got a lot of people to vaccinate in this country. We want to vaccinate 200 million people, by the middle of the summer. And that's a big task. And we're heading there, and we're going to get there. But with this event that we did at the stadium, at the University of Florida a couple of weeks ago, where we vaccinated just as a trial to see how many people we can safely accommodate with physical distancing and be able to move people through safely. We did 1,100 very easily, and now we're planning to do up to 3,000 at the stadium to continue to find efficient ways to deliver this care and get people access to the vaccine that they want. So we're doing it safely, efficiently, And we're trying to spread that throughout the state. And we're also reaching out to underserved communities. And we're working with community organizers to traditionally underserved communities. And we're doing that through churches. Churches have been an extremely helpful source for us to be able to reach out. They're trusted community members. People trust the people at their church or their neighbor's church, or even if they don't go to church, people trust these as locations for vaccination. So we've been continuing to work in that way to reach out to everyone, because at the end of the day, we don't want to leave anybody behind. And the only way we get through this is by working together. So what's next? I think we're really excited about more vaccine coming. You know, a lot of the frustration that we've all felt is that we've not had the vaccine here like we'd like it to be. It's coming. It's being manufactured. Probably within the next week to 2 weeks, we'll start getting Johnson & Johnson, which will be the 1-dose vaccine that'll be coming here soon. We're excited about getting that to add, you know, another arrow to our quiver to be able to shoot back at this virus. And also, we're just going to be continuing to reach out to people to educate them, give them information to make informed decisions so that we can really get back to normal and end this pandemic. So again, I really thanks for your time, and I'll be glad to take any questions that you get. This has kind of been my theme song here for my activities here with COVID here lately. And this is one way I justify my lack of sleep here these days. So again, I really appreciate your listening to this sort of introduction. I'll be glad to take questions that I believe that you've submitted, and I will turn it back over to Ms. Mott, who will kind of start sharing those questions with me. So thank you, Marcia. So I'll go ahead.
All right. Thank you. Yeah, we have a lot of questions. Like I said, I'm gonna do my best to get through to them. I might combine a few too here. So what happens if a person who needed a second dose and they go to their appointment and they've run out of doses? Would that person have to start over again?
No, great question. And the answer is no. We've been very conservative because we wanted to do exactly what was in the studies. But most of us believe that even if your second dose vaccine is delayed a month, 2 months, it's not a problem. We don't encourage that. We want people to stay on the schedule as much as possible because that's what the evidence showed. But from an immune standpoint, your body's defenses standpoint, you could very easily get that vaccine off schedule and you'll be fine. So that's not something even a couple months late is probably not going to have any bad effects. So you don't have to start over. You can get that second dose later when it becomes available. So if you can get that first dose, just get it as quickly as you can.
Okay. How long do you think most of these vaccines are going to offer protection? And do you think that every year we'll have to be getting a different type of, in the future, a different type of vaccine as variants change?
Yeah, no, that's a very good question. And probably the best evidence of that is that, thinking about the flu vaccine, I think we don't really know the answer. So let me start by saying that. We don't know how long the immunity will last. But the best science so far shows it'll probably be 2 to 3 years. And that's from looking at studies in the laboratory. But we're probably going to need to get the vaccine regularly. So maybe either once every 1 year, every 2 years, every 3 years. We won't know until more time passes. But I suspect it'll be similar to the flu, but not quite as often as the flu is every year. But the jury's still out on that. We're still collecting information, and we'll get a better idea by this fall when people get closer to being a year out from the vaccine.
Okay. Are there any ingredients in any of the vaccines that you're aware of that should cause long-term effects or things that we should be worried about?
No, good question. So there should be no long-term effects in there at all. There's nothing in there that would cause that. There are, with any vaccine that you give, there are some people, and it's very difficult to predict, might have an allergic reaction to something that is in the vaccine that doesn't normally give an allergic reaction to other people. That happens with all vaccines. In the studies that have been done so far, and with the experience of giving it now to about 40 million people in the US, the incidence or how often somebody has a severe allergic reaction is less than it is for virtually all other vaccines. So in other words, it's safer in terms of the serious side effects, in terms of serious allergic reactions. Now, the more mild side effects are probably more common. So people describe a little bit more soreness at the vaccine site a little bit more commonly than they do with the flu. They describe a little bit of sort of body aches, maybe the evening of getting the vaccine, a little bit more commonly than they do with the flu vaccine. But the serious side effects are far, far less common.
Okay. Is there any reason that some people will have side effects and others don't have many?
Because we're all different, and it's very, very hard to predict. I tried to joke with my wife because theoretically younger people have more side effects with the second dose than older people do. And we're the same age, but she had more problems with her vaccine. She's also a physician. And so she had more problems where she was a little bit, she didn't have problems. I was a little bit more sore the night I got my second dose. So I just said, well, it's because I'm younger than you are. That's exactly what it was. So, but again, there's no way to truly predict. And it's just most people do really well. And most people do fine if they just get symptoms where they might feel body achy or just feel a little bit sore. Just take a little Tylenol that evening. And then you're good to go. If you don't have any symptoms, don't take anything. Don't take it ahead of time. But most people do really, really well.
Okay. So we had several people who were worried about having a bad reaction. Someone said, is there a special place to get the vaccine if you're really at high risk for a bad reaction? I have conflicting opinions from doctors. I have, many allergies and resistance to drugs. How do I know where to go? It's not very reassuring to go to a vacant field and think that I could have a severe reaction.
Yeah, I think that's something to discuss individually with your personal physician right now, because the way that the vaccines have to be handled with very ultra cold temperatures, it's hard to get them to physicians' offices. And to be honest, physicians' offices are not always prepared for emergencies. At each one of our vaccine sites, we have an emergency kit and EMS trained personnel on site. So we're able to handle those emergencies if they should come up. And most sites are able to, but again, that's a personal decision about where you want to get the vaccine, and that severe reactions are extremely uncommon. And in fact, many people are elderly who have other medical problems are many times the ones who tolerate it better. If you've got multiple allergies, in those cases, people do really well. It's allergies to a previous vaccine. So if you've had a vaccine and had to go to the hospital or go see the doctor immediately after having that vaccine, then that's something where I would say I would want to get you vaccinated in a controlled situation. But if you've had a history of allergies to this or that, or problems with this medicine or that medicine, there's no reason to think that that would affect your ability to get the vaccine. And then what we do is we prolong your monitoring time. We watch you a little bit closer. Our sites all have physicians on site and available, and an emergency kit should we need it. And also we have EMS there within 10 minutes anyway, as well as on-site medical care. And most vaccine sites are the same. If they're meeting the CDC standard, they'll have the same type of approach there as well. The same wouldn't be true in many retail sites. So that's a little bit of a different situation. Retail sites will not have that level of sort of support at them as the larger vaccine sites will.
Oops, hold on, sorry. Okay, sorry, I hit a button and changed everything. Are there any groups who should not receive the COVID vaccine?
Everybody is a candidate to get the COVID vaccine. The only person that I would say shouldn't get one is that if they got their first dose and had a severe allergic reaction to the COVID vaccine, then they shouldn't get their second dose. But pretty much there is no contraindication to anyone. Now, I need to clarify that. So right now, the vaccine has not been studied in children. There are studies right now looking at children between the ages of 12 and 16, and in other studies, 12 to 18. So when those studies are done, we'll know that it's safe in children down to the age of 12. It's unlikely that children younger than 12 will be included in studies right now, but that'll probably come later next year. But right now, children have not been affected by this very much. And in fact, they're not even effective spreaders, which is very different than it is with flu and other conditions. In terms of pregnant women, that's a very common question as well. Should pregnant women get it or not? Pregnant women have been vaccinated sort of quote unquote accidentally. They didn't know they were pregnant when at the time they got their vaccine. And so they're being followed afterwards to see if there's any problems. But right now, no problems have been identified with that group. If you're pregnant and are interested in getting the vaccine, I recommend you discuss that with your OB. Right now, most public health people are recommending that women who are pregnant get vaccinated. The reason being is that getting COVID is, that has been proven to be not the best for a pregnant woman and her unborn child. And so in that certain situation, that's a medical decision that needs to be made with their physician and their obstetrician. But most public health people are encouraging pregnant women to get vaccinated until we have more proof to say that it's not safe. But again, that's a personal decision. But other than that, everybody needs to go ahead and everyone is a candidate for the vaccine.
Okay. How about a person who's received a transplant? Could they get it?
Yeah, in fact, we made a specific effort to make sure that many of our transplant patients got vaccinated. So that's an important thing. So it's important for folks who are immunosuppressed, folks who have cancer, folks who have a whole host of other medical problems. Probably the most important medical problems that we want people to get vaccinated for are those who have high blood pressure and diabetes, because we know that those groups are particularly at risk to get infected and to have worse outcomes. And also people with lung disease, except for asthma, but lung disease in general are strongly recommended to get the vaccine because they do have worse outcomes as well. In other words, by outcomes, meaning they're more likely to go to the hospital, and unfortunately, they're more likely to die if they become infected.
Okay. So we have a few questions about transmission that people want to know. Is it safe to visit a relative who's had a vaccine? You know, if they've been vaccinated and they're going to visit another relative who's been vaccinated, is that okay now?
Yeah, so the CDC is going to come out with some guidelines about for people who've been vaccinated and what people who've been vaccinated should do. Right now, what the guidance is, and I agree with it for now until we know more, is that still carry on like you did before. In other words, with wearing masks. So we still mask up. You're still careful. Don't change your behavior after you've gotten vaccinated, because we're still learning to know for sure if vaccines not only prevent you from dying, not only prevent you from getting sick, but we want to make sure that they don't that they prevent you from being infected and maybe spread to other people. So it could be that we're vaccinated, we don't get that sick, we don't die, we don't go to the hospital, but we may have a little bit of an infection, not even know it, and then spread it to someone who was not vaccinated. So until more people are vaccinated, it's best for us to continue with the masks, continue with hand washing, continue with physical distancing, and just hold on for a little bit longer. We're almost there. We're getting the data. We're going to understand it better. And then we're going to have the biggest mask burning party in history and get rid of them when we can. But right now, I think we just got to stay in there and keep fighting till the bell rings, and keep with our guidance for right now, and just not let down our guard.
All right. Is the vaccine, I think you mentioned in your talk earlier, is it going to be, it's not immediately effective after the first dose. It takes about 2 weeks. Is that what you said?
Yeah, about 2 weeks is when you see the impact. So really, that's when there's a really clear change. And then again, without getting into the details or getting all sort of scientific here on things, but when you look at the curve, right there at day 12, there's a big bump in the line in terms of the protection. So in other words, the chance of you getting COVID just drops very quickly after about 12 days of getting the Pfizer or Moderna dose. I think the data that I'm thinking of is related to Moderna, but both of them work very similarly. So it's just after that 2 week period of time, there's a big drop. Now, you need that second dose. And so we don't want people to avoid that. And we don't want you to just kind of go, 3 sheets to the wind on day 12 and say, oh, I'm safe, I'm good. Keep wearing the masks, keep doing what we need to do until we know more. And then we'll start lightening things up here as soon as we get more people vaccinated and more people protected.
Okay. Someone asked a question. I had the vaccine, but I didn't realize I had COVID. I developed a rash after the shot. When can I get my second shot?
Yeah, that's a great question. And I think that that's something, again, that, medically got to talk to your personal physician about, to take into account all the other medical problems. We've had that a few times where people had been exposed, didn't know it, got the COVID shot, and then ended up getting COVID because they were exposed a few days before and were kind of in that window. And those folks, they can have pretty significant sort of immune reactions, because now your body's got a double sort of dose, right? Kind of a little jolt. And then some people get a rash, and that's usually from the COVID and not so much from the vaccine. But in those cases, it's a discussion with your physician. There are some that are now recommending that if you've had COVID, you only need 1 dose instead of 2. But that's not become official guidance so far. And we've still got to wait to understand, get more information and more results of some of the scientific studies that are being done to know if that's really the approach that we should take.
All right. Someone asked, my son has congestive heart failure and is 41 years old. Is there any way that someone like him can get their vaccine due to their pre-existing condition? Yeah,
and that's the $1 million question. I think that's very important right now with the current guidelines. We're following the guidelines from the executive order from the governor that we focus on 65 and older, frontline healthcare workers who take care of patients directly. And then also hospitals can vaccinate some individuals who have pre-existing conditions. The problem is that hospitals and health systems don't have enough vaccine to be able to get to all of their people with pre-existing conditions at every age. And still, it remains to be seen. There's still a little bit of lack of clarity to know when we're going to be able to open it up to other people. I have my own opinions about that. My feeling is that I think we should open it up to once you get through the seniors and get 65 and older and you get a certain percentage of them done, you should open it up to everyone as vaccine becomes more available. I think this strategy has been the right one, focus on the seniors. And then once you get the majority of 65 and older, start thinking about getting other folks, because there are 66-year-olds who are very healthy compared to a 50-year-old or a 41-year-old in this case with congestive heart failure that I would want to get the vaccine a lot quicker. And then also from our standpoint at the vaccine sites, we can't sort through who has what, and we don't want anybody to prove who has what. Just think of the amount of time and documentation and getting a doctor's note and then turning people away who want a vaccine and then because they don't have the right letter. Just from an operational standpoint, it's impossible. I want to line up 100,000 people in a line and I want to give them 100,000 vaccines and get them done. Because that's how we get out of this and move things forward. So I give a long-winded answer because I don't have a good answer for how that 41-year-old person will get vaccinated right now. But I suspect as we get more vaccines, that's going to be easier. And I would strongly encourage them to get vaccinated as soon as that opportunity comes up.
Another question we have is, how will the older population know whether they've actually developed an immunity? And is it true that older people who do not develop immunity as effectively as younger people?
It's true that in general, older people do not develop immunity as effectively as younger people do. That's why the side effects tend to be less for older people than they are for younger people. However, the vaccines work in older people, and we've got proof of that. So that was included in the clinical trials, and we know that it works, and we know it works in the way that really matters. They didn't get as sick. They didn't go in the hospital. They didn't die. Those are the key things that we looked at. And so the measures that we have for immune response, measuring antibodies or this or that, those are not always the best. What's really the best is that what happens to a group of 100 people or 1,000 people that I follow over time, and do they get COVID or not? Do they go in the hospital or not? And how do they compare to a group that didn't get the vaccine? That's the most important proof. So there are a lot of different antibody tests that are out there and different people selling this and that. And if I wanted to have that, 3-month vacation in Tahiti, I would open up a lab selling, COVID antibody testing and kind of just say, hey, oh, you're immune and you're not. It's more complicated than that. I mean, it helps, but we don't make any clinical decisions based on antibody test results. So measuring that immune response is difficult for the average clinical lab. We just make sure we vaccinate people. And until we get a better test and a better idea of what's going to happen after people get the vaccine, right now, just assume you're immune, continue to protect yourself, and continue to listen to the CDC for further guidance about what we should do to kind of continue to control it even after you've been vaccinated.
All right. Someone says, if I got COVID-19 a month ago, when can I get vaccinated?
Ooh, great questions. I tell you, you guys are going to the Hall of Fame in terms of the quality and difficulty of the questions. We don't know the exact answer to that. And I think this is the challenge. What I've been telling people, and this is, there's no true clear guidance on this, but in my practice, what I'm doing is that if people have had it, in fact, it's funny, I use a month. If you've had it within the last month, I tell you, don't get the vaccine just yet. You're protected. And so from the infection that you got originally, and if I give it to you right as you're recovering, like say within a week, 2 weeks, you're probably going to have a pretty significant uncomfortable response. So in other words, you're probably going to have the same symptoms you had when you first got it. But after a month, we've seen when we've given it at least a month after COVID, people don't have those same symptoms. They tend to do pretty well. They just have a little bit of soreness. They kind of have a little bit of body aches. They wake up the next morning, they feel fine. They don't have to take any medicines. They feel perfect. So I would say wait at least a month, and then you can start your vaccine series at that point. Again, there's no clear proof of what the right thing to do is, but I'm recommending that people wait at least a month if they've had COVID and just give it at least a little bit of space.
Okay, along those same lines. So I got the first shot and then I got COVID before I got the second shot. When can I now get the second shot?
Yeah, good question. In that case, I would still probably put it off at least a month after you recover from the episode of COVID that you got. So if you definitely had COVID after getting that first shot, it's probably that you were infected before and then got it, but then I would definitely get it, finish the series, but I would wait at least a month after recovery to get it there. And again, I don't really have a lot of science behind that. That's just what we've seen from people experiencing it. And if there are guidelines on that, I haven't seen them yet. So again, I can't say that things change almost by the hour in COVID. Things move so quickly. But right now, the guidance is to at least wait a little bit and then go from there. But there's no magic number just yet.
Okay, a little more sciencey question. So since Moderna and Pfizer do not use any live vector, but alter the RNA, what will be the long-term effects of changing the RNA?
Yeah, they don't alter the RNA at all. What they do is that it has what's called messenger RNA. So basically think of it, for those of you who might use Snapchat, think of it like Snapchat. So in other words, in the vaccine is a small little packet of information that tells your body's immune cells how to make antibodies and how to fight against COVID if you're exposed to COVID. So it goes in kind of like a Snapchat message, and then it's gone within a certain period of time. I forget exactly how long that goes away, but it never goes into your RNA. It never does anything at all. Basically, your body reads that RNA, and then that RNA just destroyed. It goes away. It breaks down. That's why it has to stay in that ultra cold freezer, because it's pretty unstable. So it's got to be ultra cold temperatures. That's why once we mix it, we only have 6 hours before we have to administer it. And that's the big challenge. So it's so unstable, it breaks apart. As soon as it gets in your body reads it, it makes the stuff, and then it stops. And then that's your immune response. And there's nothing left after you get the vaccine.
Okay. Someone asked a question. After your second vaccination, do we still need to wipe down packages, grocery, and mail?
Yeah, I would strongly recommend that even without the vaccine, you do not need to wipe down packages, groceries, or mail. Just wash your hands frequently whenever you touch something from out of the house, but there's no reason to wipe anything down. And the reason why you're doing that is because the early guidance is that this is contact spread, it's spread by touch. We found that it's really not from that really in any significant way. So there's no proof now that you can get it from the packages or from the mailman or for anything like that. It's just by usually through the airborne route or by what we call respiratory droplets. So that's why the masks have been so effective. Again, wash your hands. My hands are still dry because I wash them so much during the day, but really that should be sufficient. You don't need to wipe anything else down, and that's not really going to be a risk for you with or without the vaccine. So wiping things down is not necessary.
Okay. Could you please discuss masking or versus no masking after being vaccinated? I have a family member who feels there's no need to wear a mask now that they've been vaccinated.
So we recommend that masks continue to be worn, and it's not just for that person's benefit, but it's for the people around them. So in other words, we still need to know, and there are studies that are going on, and actually UF Health is going to be part of one of the studies with one of the vaccine manufacturers that is going to look at, can people who've been vaccinated get what we call asymptomatic infection? That is, I got the infection, I don't have any symptoms, but I can spread virus and I can give it to somebody else. So in other words, once you get the vaccine, we still can't give you that, get out of jail free card and say you don't need to wear a mask, you don't need to do. We still need people to wear the masks until we answer that question. And once we do, then we'll lighten up the restrictions more and more over time. But right now, we want people to continue to wear masks because it's possible that I could be vaccinated, I don't wear my mask, I can get exposed, I can go to someone who has not been vaccinated, and I can give them COVID and not know it. So until we answer that question, just let's keep wearing the mask for right now. We're not recommending people stop using masks, whether you're vaccinated or not at this time. That's coming soon, but just not yet.
Yeah, I know we're all ready for that.
We are ready. We are ready. I am too. And it's not, I get no pleasure of wearing the masks, and I don't get any, I get even less pleasure telling people to wear them, but we're getting close. So now's not the time to quit. I want to see, my room is surrounded with all the different numbers and kind of different charts and things that we have. And I'm looking up at our whiteboard right now. Those numbers are dropping, and they're dropping because we're wearing masks. Keep it up. Let's keep going, and let's kind of stay with that even as we vaccinate, because we're almost there. We're almost there. Just hang on a little longer.
I know. Yeah. It's funny. It kind of seems normal now. So someone says, what is the known effectiveness of the currently approved vaccines on the newer, more contagious strains of COVID-19?
Yeah, very good question. So right now, it depends on which strain you're talking about. So Moderna and Pfizer work really well against what's called the UK variant, first identified in Great Britain. And there they work well. There's a little bit of a decreased effectiveness, but still in the 85+% range. So very, very effective still. The other thing that let me get back to that point here in a second. The South Africa variant, which is not as widespread as the UK variant is, may have a bigger impact, particularly with the other vaccines, with AstraZeneca in particular. And so right now, Pfizer and Moderna both are doing studies looking at the new strains to see if they can kind of tweak it to make it more effective. But let me just say a quick word about the variants. The variants are important and we're paying close attention. And so I don't want to minimize that. That's something that we want to look at. And for those who don't know, those variants are where there's a mutation, that there's a new strain that causes the virus to behave a little bit differently. So in other words, does it make you more sick? Is it easier to spread? Does it avoid the vaccines? And right now, the jury's still kind of out. It looks like it might be more spreadable, but not that much more spreadable. It looks like it may avoid the vaccines in some people, but not completely. And so right now we're recommending just continue to get the vaccine because it works. And two bits of proof related to that. One is, as I mentioned before, is that in every study that was done, in every setting around the world that were part of these studies for Operation Warp Speed, nobody who got the vaccine died of COVID. And these strains were certainly circulating at the times of these studies. And so that's important to remember that didn't happen. Now we need to continue to look to see that that's still the case, but that's really important. The other thing is that we measure failure by, if I get a runny nose and a cold and someone does a COVID test on me and it's positive and I feel fine, I just got a little bit of a runny nose, I'm considered a vaccine failure. But who cares about that, right? What do we really care about? We care about those numbers that I talked at the beginning, where 500,000 Americans are dead from COVID, right? That's what we want to stop. If there's one more virus that causes cold symptoms, does anybody really care? Not really, right? So again, these prevent that, but really the thing that matters the most is that who dies, who goes to the hospital, how sick do people get? Again, it's all linked together. I can't just say you can have one thing and not the other, but my point is that the vaccines have an impact beyond just its effectiveness. So if you can say that a 66% effective is better than a 77%, it's like, not really. It's like really at the end of the day, they're all very effective in the thing that matters the most. And also, as we give the vaccine, if you get it and I don't, I still benefit. And this is one of the few things, education being the other one, where if you get it and I don't, I can still benefit. Society still benefits because we're moving to that point where you've got what you've heard a lot, herd immunity, where enough of us have immunity, where in other words, we don't get sick from the virus and can't spread it, that there are a lot of dead ends where the virus can't spread anymore. And then it just goes away. Again, this may never go away completely. It'll go to the point where it's just not really a public health problem like it is now. But right now, that's the key that we're looking for. So I really want to encourage people that get the vaccine, they work, the impact of these variants are there and we need to watch it. That's another reason why we need to limit the spread with the use of masks. We don't want to give this virus a chance to mutate and grow and kind of become a bigger problem. The longer it lingers, the longer it can escape. But the key here is that we're still in control. And this is the moment where we need to really press hard, keep our foot on the throat of the virus and just don't stop until we get it all done with wearing masks, getting the vaccines, and keep going hard throughout the spring.
Okay. Someone asked, I need to get a shingles vaccine series. I've had my 2 COVID vaccines already. How long should I wait in between?
Yeah, I would say wait at least a month in between. So from the last dose that you got on the COVID vaccine, wait a month before you get your shingles vaccine.
All right. Can you
and again, discuss that with your physician as well. So I want to be careful not to give medical advice specifically, right? But that's something to talk with your physician. But in general, we want to have there to be a month gap in between.
Okay. Can you please explain if this is true or not? Is the vaccine is making our bodies fight a certain protein that the virus is based on. However, the same protein is important for reproduction in women. Thus, the vaccine may render infertility.
I'm glad that question came up because I've heard that several times before. The protein that has nothing to do with pregnancy whatsoever. And the protein that is there is the spike protein, which is not found in humans. It's a totally different kind of protein. It's a target within what's called the spike protein. So the coronavirus is just kind of think of it as a ball with little spikes sticking out of it that kind of give it a crown look around it. That's where the corona name comes from. And that spike protein are kind of like the landing gear of a plane. So if we develop antibodies to where that landing gear never can get into the receptor or the place where it lands inside of our bodies, then it can't land, and then you just kill it and knock it off. Or if it lands, our body's immune system attacks it immediately and it dies off. And so with that, that's what our immune system attacks, but that protein does not exist in our bodies. So building that immune response does not affect us long-term or short-term in terms of once you build immunity to that virus. It's just specific to the coronavirus.
Okay. Someone asked about the Johnson & Johnson vaccine. Since it's only one dose, is it more potent and maybe have more side effects?
No, good question. Just kind of remember that they're probably going to look at and see if the Moderna and Pfizer can be given as one dose as well. It's just think about the time frame. So in other words, there was a limited amount of time. They wanted to get the studies done. So they just said, okay, we know we think we're going to need a booster. Let's do it at 4 weeks and then see. But that booster may not have been necessary. They wanted to be sure that since it was tolerated so well in the early studies, in the earlier kind of what we call clinical trials, they said, well, let's just give 2 doses because it's tolerated so well. We want to make sure we overshoot rather than undershoot. The Johnson & Johnson vaccine, they actually compared, they had time to kind of look at 2 different studies. They actually did at the same time as the 1 dose, they did a 2 dose. And in their study, they found that, 1 dose was good enough. And so they actually had the time to be able to study both. And so it's not that it's more potent, it's actually a totally different vaccine. It works very differently. So it doesn't have a higher dose or more of the same. It just works differently, but they were able to do 2 head-to-head studies to compare the 2 groups. So that data is going to be shared here with scientists in the health community here in the not too distant future. But really that was kind of the overall structure. So it gave us a good idea that they could work with just 1 dose.
Okay, I got a couple questions about steroids. Someone says, I have asthma and I haven't really reacted to a vaccine in the past, but does my being on an inhaled steroid every day affect my effectiveness?
Nope, go ahead and take it. And even if you were taking oral steroids for asthma, we'd still recommend that you get the vaccine and go ahead and get it. So it's just, I would go ahead and get it regardless of whatever other medical treatment you're on.
Okay. Someone asked, is there, can I still get together? If everybody in my group has been vaccinated, do we need to wear a mask when we get together?
That's a good question. Right now, I mean, I think we're still doing that. And that's a debate actually with most of the people that I work with have been vaccinated because we're all taking care of patients with COVID and involved with COVID daily, multiple times a day. And in those cases, we're still wearing masks. I think it's just a choice and a decision where I think it becomes really clear where you don't have to wear a mask is outdoors. So if you're outdoors with people that have been vaccinated, you're certainly safe enough to do that. I think CDC guidance will be coming out shortly to say if you're all been vaccinated, can you get along without masks? And I think there the question is that, again, we'll have to make that decision. My gut feeling is, yeah, of course. But until you know who's been vaccinated, who hasn't, until you know what's going on in the community, I'm very reluctant to say, oh, well, if you've been vaccinated, you're good. Because again, I want to keep us on the mask because I know that's going to be critical for us to kind of get through this, at least until enough of us are vaccinated.
All right. Maybe you could talk to us really quickly. I got a couple questions about masks. Is there a type that's better? I know I've heard some things recently about maybe we should all start wearing not an N95, but at least a surgical mask instead of a cloth mask.
Yeah, I think that a couple of things. Masks should be multiple layers, and the surgical masks have multiple layers sort of built in the way it's kind of manufactured. I think that what I've always told people from the very beginning is that the most effective mask is the one that you'll wear. So again, the benefits from having cloth versus surgical is, minimal. I think surgical mask is clearly going to be better, but if you're not going to wear a surgical mask because you either can't get it or don't want to, but you will wear a cloth mask, I'll take what you will wear. So I think that's the key thing. What we know doesn't work very well are sort of the gaiters for fishing and just kind of very thin cloth that you wear so you don't get windburn or sunburn when you're fishing. Those don't work very well. And those are ones that I would not recommend, the neck gaiters. But otherwise, cloth masks are at the bottom of the list, followed by surgical masks are better. And then N95s or KN95s, then N95s at the medical grade are the most valuable. But the average person does not need N95s. They don't even need KN95s. Cloth masks or surgical masks are interchangeable, with surgical masks probably better.
Okay. Would a person who has Down syndrome have any possible issues from getting the vaccine when it's available?
That's a good question. Yeah, they should be able to take it like anybody else should. Again, I want to be careful in that speaking in generalities that, again, I'm not going to be giving specific medical advice to folks for specific medical conditions without, be irresponsible without looking at someone's chart and having them be my patient. But in that setting, someone with Down syndrome would be a candidate to receive the vaccine like anybody else would.
Okay. So I got a couple of questions of people who are interested in getting the vaccine. And they said, I'm having a hard time getting an invitation for the vaccine. I have severe lung disease. Is there any way to get an invitation? Is there any resources that you could direct people to?
Yeah, I think right now what we're trying to do is to kind of have people go to the vaccine finders. So right now we're still restricted in terms of who can get vaccinated and who can't in terms of age and occupation for now. But I think that that's going to be lightening up here very soon. Once more vaccine is available, we'll be moving away from the 65 and older to include all other groups here, hopefully soon. My own personal opinion is that creating these sort of lists of priorities about who goes first and where they are and where things fit, that is not realistic. The reality is that really the only thing you can truly check is age. And then after that, there's no way to really document or qualify who goes where. And what you've done is you pit one group against another. I think now my opinion is that we open it up to everybody, but I'm not in charge, so I don't get to say. And I still think that focusing on getting seniors done because of the higher consequence to them in terms of worse illness and going in the hospital is key. But opening it up and then having it available for people and just find ways to very efficiently have people register, get them in, market it to people who have risk factors. Like several folks have called in with lung disease. I really want to get them. People who have heart disease, I want to make sure that they get taken care of first. For that young person with Down syndrome, many times they have other comorbid or other conditions, medical conditions as well. We want to make sure we take care of them. But we just can't do that just yet. So as vaccine becomes more available, that'll be possible. But right now, just kind of bear with the system. And as soon as we get permission to kind of open it up, you can guarantee that we will be running as fast as we can to do this safely and as efficiently as possible.
Is the second dose the exact same ingredients as the first dose?
Yes.
Okay. And someone asked, are you concerned about the B.1.1.7 variant from UK spreading quickly in Florida?
Yeah, so actually that's what I kind of alluded to before about the UK variant being out there. And yeah, I mean, I think that that's something that we're concerned about. The University of Florida is right now, we're working with the state, but we're also working on projects right now doing a lot of sequencing. So what sequencing means is that we get the virus and then we get the genetic material, in this case, RNA from the virus, and then we look at that in the lab. And then that's how we determine what kind of strain, what family it is, what kind of germ it is. And we can tell if it's UK B.1.1.7 or some other strains. I am concerned that it could be there, but it's not changing anything. And to be honest with you, if the variant is out there, that's actually really good news because rates are dropping faster than ever. And then it means that it's really not having a big impact. So we've got to watch. I've got cautious optimism, but I really, gosh, I was referred to myself as Debbie Downer before because kind of around the fall and into the winter, I was just giving people all sorts of bad news. This is what's going to happen. This is what we need to do. Nobody invited me to parties anymore. It was terrible. So no one wanted to talk to me. But likewise, I want to share good news. The news right now is good. Numbers are dropping. We've been through a lot. I'm probably on a call with this many people on it. There are no doubt people that have had family members or themselves have been in the hospital or lost family members. I mean, this is a tragedy that's been unthinkable for any of us. We feel like we're living in a sci-fi movie right now, and it's been awful. But it's so important to just share good news when it's there. The rates dropping the way that they are, and I'm looking at the numbers now, that encourages me every day. The fact that we have vaccines, we've been beaten down quite a bit, but the fact that we have two vaccines, soon to be 3, and probably a 4th and a 5th and a 6th by summer or sometime by the summertime is incredibly good news. And they work this well. And yeah, there's things that we need to look out for. And yeah, there are the variants that are out there, but let's focus on good news. I always say that I'm a bounded optimist, right? So I'm optimistic, but I'm not just going to blindly say it's all good, right? It's like I'm optimistic if certain things fall into place. And right now, those things are there. So there's reason to be optimistic. There's reason to be motivated. There's reason to keep charging hard. And I just really want to encourage all, several hundred of you that are on this call that, there's a way forward, and just kind of hang in there a little bit longer. Your time to get the vaccine will be there. We will do the best we can to make this as smooth a process as we can. Show us grace. We're trying to show everyone else grace because we know everyone's been through a lot, but show us grace as we kind of work through some things as we go along. We'll get through this together, and we'll be there with you. So just hang in there. The news is good. We just got to be patient just a little bit longer, and we'll get there.
All right, I'm going to take one last question. I think it's the best question of all. Do you think that the swamp is going to be filled this summer with Gator fans, or this fall rather?
Yes.
All right.
I'll give you the one word answer. I cannot wait to be in a full packed swamp. That's my hope. Again, anything can change, but that is my hope, that we will be in there packed and be back to normal. I'm hoping.
Well, I thank everybody for tuning in today. I know we still have a few questions we weren't able to get to. I'm going to see if I can get some of those answers to people through the chat here in just a minute. But I know Dr. Lauzardo's probably got a million more things to do today, and we want him off taking good care of us and helping us, guide us with this. And we thank you for all your efforts, and thank you today.
No, thanks so much for having me. I appreciate it, and look forward to doing this again. And if there's a need for it, we'll just certainly continue to reach out to community and just want to keep encouraging people. We'll keep sharing the best information that we've got available, and we'll tell you the good news and the bad news. But right now the news is good and encouraged, and we'll just keep working with all of you. So take care of one another. And again, thanks for your time and sitting here with us this afternoon. Thanks so much.
Thank you.
All right, thanks. Bye-bye.